첫 번째의 발제자는 하버드 보건대학원 T.H.Chan School of Public Health의 스테판 베르게 교수님이십니다. 스테판 베르게 교수님께서는 현재 같은 학교 내에 헬스 디시전 사이언스의 코어 패컬티 멤버이시고요. 학교 보건과 영양 연구 컨소시엄의 Analytic and Metrics Committee of Practice의 코체어이십니다. 그리고 사실 이제 스테판 교수님은요, 그간 경제성 평가 그 방법론의 주 비판이 되어 왔던 형평성에 대한 고려가 없다는 그런 점이었는데, 비용 효과성 분석의 형평성과 같은 그런 분배적 효과성까지 담는 분석법인 Extended Cost Effectiveness Analysis 분석법 모델을 공동 개발하신 연구자이십니다. 연구 분야는 이제 주로 그 비용 효과성 그리고 우선순위 설정 그런 분야에 있습니다. 오늘 스테판 벌게 교수님께서는 The Value for Money of School Health Program이라는 주제로 줌으로 발표를 해주시겠습니다. 연결 부탁드립니다.
Hello, hi everyone. Can you hear me okay? So good to be with you. What I'm gonna do today is to give you an overview of the value for money of school feeding programs in Sub-Saharan Africa. And so the outline I have for the presentation. So what I'm gonna talk about is really the kinds of scope that we're thinking about when we think about value for money. And then I'm gonna present two illustrations for the case study of school feeding in Malawi and then in Ethiopia, and then I will have a few take-home messages. So when we talk about the value for money of school feeding programs, really what we mean is that on the one hand, there are comprehensive costs, potentially large costs for the school feeding programs, but also very importantly that there are multiple sectors that accrue benefits. Education, you can enhance the schooling, the learning. Health and nutrition, you can improve a healthy diet of learners. Social protection, how maybe that can help to reduce poverty. And then lastly, the local agricultural sector by developing local production of food. And then in the end, the idea is that with these elements, you can really inform a detailed cost-benefit model that governments can then adapt, tailor to their realities so that they can really set priorities. In terms of the work I'm gonna show in a minute, there were a combination of two factors which made this possible. On the one hand, really relying on strong secondary data sources, government reports, education, health information systems, but also, of course, household surveys, as well as a bit of a published literature. And clearly, this is a multi-stakeholder program. So that means that national technical working groups across different ministries, ministries of health, ministries of education, but also agriculture, social protection, finance often were involved, in addition, of course, to regional organizations and local academics. Just to give you an idea of the work that we are embarked with, this is a map partially up to date, actually, in terms of the colors here, but of all the countries for which we have completed studies in Africa here, there's ongoing and then future efforts going on in Cambodia, the Philippines, the state of Tamil Nadu in India, as well as in the United States, Brazil, and actually many more countries working with us in the coming year. So let me just present a few country case studies to illustrate what I meant First, I really want to acknowledge the contributions of many, many, many people. And this work would not have been possible without the engagement of a strong multi-sectoral and interdisciplinary team in each country, and in particular in the country of Malawi, where under the leadership of Albert Saka at the Ministry of Education, we were able to really engage with a wide array of colleagues and stakeholders. What is it that we do? This is a map of the schools in Malawi. These are the dots that you see, and in colors, these are the schools that receive a school meal from one of three program partners or implementers. And what we do in those analyses is we compare the schools and the learners who receive a meal, these are the colored dots, to the schools that don't receive meals. And of course, the art of the analysis is to control for confounding variables, including confounding factors like obviously socioeconomic status. And what we do is we then compare and simulate a cohort of primary school students and compare those who would receive a meal and those who would not receive a meal across the different benefits of the different sectors that I've mentioned earlier. So what do we find? First, looking at education, we find that school feeding would increase years of education in all regions of Malawi. And besides an average of about 10% lengthening of the duration of schooling, we see a wide variation. As you can see here, a map of additional years of education for a school feeding beneficiary. You see that with the shading that you have here, that in spite a positive average, and in fact positive benefits everywhere, there's quite a bit of nuances and differences across the country. That means that, as you probably are familiar with, we know that better education means better jobs, better wages in the future, and that translates to better job opportunities and future income for those beneficiaries in the future who are less likely to end up working in the primary sector, and then would accrue a substantial additional number of wages in their future adult working lives. So that's benefit number one, education. Benefit number two is health and nutrition. In particular, really leveraging the evidence from randomized trials that school feeding can contribute to the reduction of anemia. We find that for about 1,000 beneficiaries, we estimate that you could have up to 400 cases of anemia that will be averted in the population, and that can be translated in terms of additional years lived in good health. This is, behind this, it's really the number of DALYs averted, disability adjusted life years averted, a classic metric that we use in economic evaluation for 1,000 beneficiaries. But again, I want to insist on the vast nuance in the shading here, as you see that the extent of the benefits of those health and nutrition benefits really vary largely depending on where you are in the country. Third, very important, school feeding is a substantial value transfer to households in Malawi. This is really captured by here the value of a transfer of the value of a meal annually, the value of the meals that are distributed, compare in that particular case to total annual food expenditures by different region. There's just different maps because there's two distinct modalities of implementation. And what we find is that, obviously, as you see on the map here, with the different percentages in terms of the ratios that vary quite a bit from north to south, we find that for the poorest households, per beneficiary, so it could be multiple times this for several learners in the same households, that represents a transfer of up to 10% of annual household food expenditure. So that really gets at the equity benefits of the school meals and their redistributive aspect. And then fourth, if you think about how these food in the schools, they can contribute to, or they can be procured locally by smallholder farmers, we estimate that this is equivalent to a transfer of about $12 million based on the current needs in the country in terms of the current beneficiaries. And of course, these investments in agricultural supports can create, that means it creates a stable demand potentially for about 30,000 smallholder farmers, as well as potentially providing support for households to boost their crop production. Now, when you put things together and you focus on the benefits toward education and health and nutrition, which come in monetary terms here, what we find is that this is very good value for money. School feeding in everywhere in Malawi, on average, for $1 invested, you have about $8 of benefits. But this is a weighted average. And really, again, I want to point to the fact that this is really important to do some national analysis like here, because you can see the great variation from north to south in terms of the benefit cost ratios, right? Up to 18 potentially, and maybe as low as 3 depending on the region you are. So I think that's a point, that the point here is that these averages really mask a lot of heterogeneities, which are quite useful if you think about setting priorities and you have limited resources for where you want to really perhaps start expanding your program. So that is Malawi. Now I'm going to talk about Ethiopia, and I will just emphasize a couple of things. The situation is quite similar, but of course, things are distinct in Ethiopia. And again, this would not have been possible with the involvement of many people. A very dedicated interdisciplinary team, in particular under the leadership of Dr. Solomon Memerie at Addis Ababa University, and thanks to our technical working group in the Ministry of Education, chaired by Ato Dawit. And also I want to acknowledge particular the leadership of Johannes Wogaso in the Ministry of Education. So couple of messages, a couple of points for Ethiopia to re-emphasize some of the messages that I've said. But first, in terms of the beneficiaries, this is the map from 2 years ago, or 2022 data of the current beneficiaries in Ethiopia. For those of you who know Ethiopia, you will recognize right away that the Oromia region here concentrates the vast majority of the current beneficiaries, which means that some of the results you will see will be driven by the situation of the Oromia region here. Now, what is very timely in Ethiopia is this coincides with very ambitious national plans, national school feeding policy targets, and more generally, national agricultural policy strategies, by which by 2030, there's the ambition to reach universal coverage in the country. So what I'm trying to say here is this is quite timely to do those kinds of analysis in this context, because again, under limited financial resources, perhaps this is really helpful to then think about the places where the benefits are the greatest, or that the equity benefits can be the greatest as well. A couple of things I want to emphasize, which come a lot in those value for money studies. I'm not going to go over all the benefits, but two things which strikes me as quite important in all settings, besides the very important nature of the multisectoral benefits, is that school feeding increases years of education in all regions of Ethiopia. Same story here, largely driven, as I said, by Oromia. But you can see here that it's positive. But of course, depending on where you are in the country, perhaps when you have higher baselines of education, the returns are lower. But you can see quite a bit of nuances and differences in the country. The second point I want to emphasize again is the equity social protection aspect, that this can be quite important. The ratio in percentage, the value of the meals annually that are distributed to certain household expenditures metrics, like household expenditures, food household expenditures. And what we find is that per beneficiary for the poorest, we obtain non-trivial amounts of funds and in-kind resources that are being transferred, meaning that the potential for households to free resources for other things. So in conclusion, I want to reiterate a few points. What we find is that the school feeding programs in those several, and it's been consistent in the 7 countries for where we have completed value for money studies, the message has been quite, or the findings has been quite consistent. There's improved educational outcomes, so far really focusing on the years of education achieved. Now, in some places, we do have also access to quality of education, test scores, but not in a systematic manner. Secondly, this is improving the health and nutrition of learners, especially focusing on a few outcomes like anemia, also potentially stunting, as well as WASH, diarrhea. Very, very, very important from an equity perspective, redistribution perspective. We're touching upon really social protection here, that we can achieve substantial monetary transfer to households through delivering school meals, especially those most marginalized, the poorest, and then of course potentially through homegrown school feeding programs, homegrown school feeding modalities that can represent a substantially important transfer to local smallholder farmers, the local economy, and sort of like ignite the beginning of like having stable markets where those farmers can sell their products. And to end, I would just say that from an economic development perspective, school feeding yields positive net monetary benefits pretty much everywhere you are, every region of every country. But again, I will emphasize that it's very important to look at these things granularly, subnationally, as I hope I convinced you on the maps with the different colors. And often what we find, but not always, and for sake of time I didn't present here, is that there's greater benefits that are expected for young women and girls. Thank you very much for your attention.